Good morning, everyone. Welcome to the Chosun Ilbo Asian Leadership Conference webinar. Today's topic is evolution of telemedicine after COVID-19. As you all know, the COVID-19 pandemic highlighted the importance and usefulness of telemedicine globally. Telemedicine is here to stay, and it has become a foundational component of medical services. The decoupling between the number of confirmed cases per day and telecounseling and prescription numbers is a clear signal that Koreans have embraced telemedicine. Therefore, it is very timely to overview the evolution of telemedicine in Asian region. As we all accept living with COVID-19 or next coming pandemic as the new norm. I would like to thank Chosun Ilbo for providing this webinar, and it is a great privilege for me to moderate this occasion. I'm Professor Jong Paik. I'm the President and CEO of the Seoul National University Bundang Hospital and serving as the Chair of the Academic Committee of the Korean Telemedicine Society. Today, we have international speakers to discuss and provide solutions to pressing issues faced around the Asia and globe. Professor Nangaku Masaomi is with us. He is the Vice Dean of Graduate School of Medicine at the University of Tokyo and the Chair of the Telemedicine Committee of the Japanese Medical Science Federation. Dr. Sang-dong Lee is the President of Hana ENT Hospital located in Seoul. His hospital has been designated as one of the centers for home treatment of COVID-19 patients. And Mr. Ho Young-ban, co-founder and CEO of Neofect company. His company is providing a tele-rehab platform and devices in Korea and US. Welcome, everyone. I would like to open this webinar with brief introduction of the concept of telemedicine and the status of telemedicine in Korea. First, it is important to distinguish telemedicine from telemonitoring. Telemedicine involves human-to-human consultation between doctors or between doctor and patient. On the other hand, telemonitoring does not need human-to-human consultation. Through telemonitoring, we can continuously check patients' vital signs and biosignals. Not all clinical fields are ready to fully embrace telemedicine. That does not mean these fields reject telemedicine, but are looking into ways to introduce it more conservatively. Radiology, dermatology, and ophthalmology are departments with lots of images, and treatment decisions are made largely based on images. They are the early adopters of telemedicine. And medical fields who sees chronic patients such as cardiology and diabetes care can benefit greatly from telemedicine and telemonitoring. Psychiatry and rehab medicine also sees great potential in telemedicine too. Korea began its telemedicine journey in 1998. The Remote Image Diagnosis Project was the first pilot project of Korea. In 2002, thanks to the amendment in the Medical Act, telemedicine between licensed medical professionals were legally permitted for the first time. In 2006, the first patient-physician telehealth pilot project took place, but it never made to the next stage. Since then, there were many pilots, but never a full-scale operation. COVID-19 changed the dynamics of healthcare delivery, and the Korean government temporarily legalizes telehealth between patients and physicians. After this permission, prescription through telemedicine reached 3.5 million cases. Now, it would be great to hear the vivid experience of telemedicine care during this period in Korea. As I mentioned earlier, Dr. Sang-dong Lee's hospital is running a center for home treatment of COVID-19 patients. Dr. Lee, could you share the experiences of running the telemedicine clinic for COVID-19 patients?
Thank you for your chairman. It's an honor to attend the ALC webinar and discuss the future of Korean medical service with distinguished experts. Since last November, Hana ENT Hospital has been designated as a cooperative hospital for home treatment of COVID-19 patients in Gangnam, Seoul, and has operated a home treatment center. Home treatment center is a system in which patients with asymptomatic or mild COVID symptoms stay at home and receive treatment remotely from medical staff at cooperative hospital. So far, our hospital has treated a total of 2,448 patients. Among them, 2,862 people have recovered their health, and roughly 300 patients per day are remotely taken as of today. Looking at the statistics so far, there has been no deaths or urgent transfer to a COVID-19 dedicated hospital during their home treatment. Of the total patients, 2.5 were transferred to a dedicated COVID hospital, but most of them show mild symptoms and were transferred simply because of transfer protocol. The transfer protocol is that if symptoms such as cough and fever do not improve for 3 days, despite the medication treatment, one must be transferred to a dedicated hospital. Patients transferred according to the protocol are not urgent cases. The process of home treatment is as follows. Patients designated for home treatment have to measure their body temperature and oxygen saturation rate using a device provided by the public health center and submit it to our home treatment center. At the home treatment center, nurses call the patient twice a day and doctors once a day to check for change in symptoms. If a prescription is necessary, doctor will prescribe the medicine and pharmacy or the public health center will deliver the prescribed medicine to the patient's home. The home treatment center is indeed practicing telemedicine every day. We have also implemented the video call system to make more accurate diagnosis. For patients who consent to video call, doctor conduct face-to-face remote treatment with the patient via video chat every day. In this session, you can directly see the patient's facial condition and movement, so you can get a lot of information that's difficult to obtain through voice call. Video call is especially useful for children who are not easy to explain their symptoms. If you watch a baby squirming and running behind its mother while you are on a video call with her, you can clearly see that the baby has no fever and no muscle pain. Also, if the patient's skin is unusually red or the eyes are not clear, doctor can detect delicate signs of his or her condition. Before starting the home treatment of COVID-19, Hana ENT Hospital has already provided remote face-to-face treatment to respiratory clinic patients and general ENT patients who required repetitive prescriptions. Respiratory clinic patients have symptoms such as cough, fever, and runny nose. During the COVID-19 pandemic, patients with these symptoms have a hard time to get access to a hospital. Also, among ENT diseases, allergic rhinitis or polynosis patients usually visit the hospital several times a year and receive repeated prescriptions without special diagnosis. For these patients, receiving prescriptions through remote face-to-face treatment without actually visiting the hospital is a blessing. Thank you.
Okay, Dr. Lee, what would be the benefit of telemedicine in your experiences?
Telemedicine has been sufficiently verified during the COVID-19 pandemic. First, through telemedicine, patients can be relieved from the inconvenience of having to visit the hospital frequently. Second, in a situation where both hospital and patient need to be protected from infection, being able to minimize patient visit to the hospital is a great help for social distancing. Third, telemedicine may be a way to provide better medical service to the elderly with limited mobility at this time in a rapidly aging population. Yeah.
Okay, I would like to add that the telemedicine can be a great tool to bridge the medical access gaps and disparity that existed within a country and region. Making hospital accessible is best aspect of telemedicine, but there is a concern that lowering the walls might put the already fragile healthcare delivery system in peril, especially in Korea, as patients take advantage of the easily accessible larger hospital via telemedicine, bypassing the small local clinics. Dr. Lee, what is your position to this concern?
Yeah. Some fear that telemedicine would threaten local clinic and increase the dominance of large hospitals, but I do not agree. Large hospital and local clinic must have completely different approach in operating telemedicine. In large hospitals, telemedicine should be used primarily for follow-up care after surgery or post-treatment of severe illness such as cancer and heart problems. In addition, large hospitals must find a way to remotely perform advanced medical treatment for patients who have difficulty visiting the hospital. An example would be in the field of remote robotic surgery, which is already practiced in the countries such as the United States and China. On the other hand, local clinics are suitable for more local-oriented remote treatment for residents. For example, elderly people who want simply a prescription for cold or rhinitis but have a hard time visiting clinic can use telemedicine. Local clinic doctor can diagnose their condition and prescribe through a video call treatment. Since most patients are local residents, doctors should be familiar with their health record. In this respect, local clinics can be improve their primary role as community health care post by telemedicine.
Okay, thank you. So when we analyze the number of teleconsultation by hospital type during pandemic in Korea, local clinics had the highest number of teleconsulting cases. Okay, so now let me share the experiences of telemedicine as a tertiary hospital. During the height of the pandemic, the government started to operate so-called community treatment centers to hold patients who had almost recovered but still tested positive or were low risk waiting for hospital admission with mild symptoms. It is very similar experience with Hana ENT Hospital. We utilized rapid response dashboard system and PHR personal health record and electronic survey system, which were already developed by our hospital and used in different purposes. That means that we were technically very ready. We also opened the telemedicine clinic during the pandemic. Our guideline using telemedicine was for follow patient who had a medical record having a previous appointment in 6 months with no changes to their prescription. And the last piece of our telemedicine effort is the tele ICU. Our hospital developed and implemented a tele-ICU platform for telemedicine among medical staffs. Using this platform, medical staff in the ICU can remotely consult with medical staff in other locations of a hospital or even outside the hospital. We also provide medical opinion and consultation to secondary hospitals who may be short on ICU staff or lack expert in certain fields. This has been a great relief on the enormous burden ICU staff had to face during the height of COVID-19. And using this platform, we are playing a key role in managing the limited ICU resources available in the province region. Mr. Ban, I know that you are deploying the tele-rehab service under the sandbox regulation. Can you share your experience?
First of all, I thank you for the invitation for this great event and having a great chance to share my experience and my perspective. And it's great honor to uh, honor to join this with the great speakers and Dr. Peg and the Dr. Lee and Dr. Masaomi. And I will tell you about our experience, our company experience in the sandbox. And the sandbox is some kind of the special kind of measure to allow company to a business which is not allowed in the current legal system. As you know, the telemedicine is illegal in Korea, even though it is now is temporarily allowed in the COVID situation. And we submit the sandbox program in the early 2020 and were accepted in June 2020. Uh, Unfortunately, but we have not started our service because we are still in the process of solving reimbursement issue and payment issue. We are allowed to sell our service, sell our the solution and system to the hospital and patient, but in hospital using our solution are not allowed to get reimbursement or payment from the government insurance or patient. As you know, hospital will not buy or use our solution without the solving the insurance and payment issue. That's why we have not started our business in Korea yet. We are still talking with the government insurance organization, and we got recently we got great positive feedback from them, and I hope that we can clear the process in this year. And Sandbox the program is the program for the system for whole other can be adapting the whole other industry, but we can accept it in the we allow to sell our solution, but in the medical system, the payment and insurance is very important. That's why we have not started this service yet. That's why, yeah.
Okay. Okay, so now let's hear the situation in Japan. Professor Masaomi, could you share the situation in Japan during the pandemic, including laws and responses from the patients and doctors?
Thank you very much, Professor Pike. And first, I'd like to thank you and the organizing committee for giving me this important opportunity to participate. I think we are facing the common problems, both legally and reimbursement. The Japanese law of Medical Practitioners Act requires face-to-face physical examinations. So we had been afraid that our act might be illegal if we do telemedicine. However, in 1997, the Ministry of Health, Labor and Welfare of Japan announced telemedicine is not necessarily illegal if doctors get enough information. But that did not work out much. Doctors still hesitated to do telemedicine. In 2015, the Ministry of Health, Labor and Welfare once again announced telemedicine is not illegal if telemedicine is intermittently done between face-to-face physical examinations upon request by patients. However, it was limited only to stable patients with chronic disease. In 2020, because of the COVID-19, the Ministry of Health, Labor and Welfare announced the exemptions due to the COVID-19 pandemic. Telemedicine can be used for new patients. This is the special exemption under the pandemic of COVID-19. Then, did we experience a huge increase of the number of telemedicine? Unfortunately not. I have the data of National Clinical Database. Although our government emphasized importance of telemedicine, from October 2019 to September 2020, the number of institutions which got reimbursement for telemedicine was always about 90,000 per month. No change at all. This was surprising. We are currently analyzing what the barriers to perform telemedicine in our country are, and I will come back to these issues later. Thank you.
Okay. Let me share the law state in Korea. So we often see law lagging tech and medicine. Telemedicine is classic example of that. I think Korea is more conservative than Japan. Korea's Medical Act allows only doctor-to-doctor telemedicine, although telemedicine between doctor and patient and prescription is being permitted temporarily, as I said before, during this COVID times. Other requirements are there must be a separate telemedicine room and technical equipment such as terminal capable of transmitting and receiving data and images and a server, etc. Most important point is that legal responsibility issue. Many clinicians are especially afraid of malpractice or negligence claim that goes into lawsuit during telemedicine practice. In the current law, there is no exemption or excuse for this legal responsibility. Therefore, clinicians and hospitals can only act more conservatively toward telemedicine, leaving patients demanding wider use of telemedicine frustrated. We need to align these discrepancies in law to maintain the legal telemedicine after the pandemic. And what would be the barrier deploying telemedicine in Japan, Professor Masaomi?
Thank you for your question, Professor Pike. Now I would like to talk about reimbursement. One important barrier against telemedicine is low reimbursement. Currently, doctors who are involved in telemedicine are mostly those who work at private clinics. The number of hospitals, especially big hospitals that do telemedicine, is very small. I discussed with those who do the telemedicine at private clinics, and they told me that they are responsible for administration of their own clinics by themselves and can make a decision to do telemedicine. In contrast, for example, I'm working at the University of Tokyo Hospital and I am an employee of the university. The university has an independent administration team and they require higher reimbursement. If we do telemedicine and get lower reimbursement, they tell us not to do telemedicine because of low reimbursement. That has been a big issue. This has been criticized, and the government raised reimbursement for telemedicine last week. However, it is still lower than reimbursement for face-to-face medical issues. The other issues in Japan, I think, include technological difficulty, especially for the elder people. We have a lot of old people. Our country is aging rapidly. Care at telemedicine may be perceived as impersonal or indirect when compared with face-to-face, and patients may feel uncomfortable. And our country is small and the population density is high. So patients may feel telemedicine is not necessary because they have very easy access to clinics and hospitals. Doctors are also feeling uncomfortable and uneasy because regulations or law about telemedicine are still preliminary and imperfect. And we have the same concern. If we do something wrong, we may get sued if we do telemedicine. So these are very high and important hurdles we have to attack. Thank you.
Okay, so we have very similar situation between Japan and Korea. So in Korea, according to one survey on satisfaction level with telemedicine, the patients were highly satisfied with 87% of respondents answering positively. Ironically, nearly the exact number of steps were dissatisfied with telemedicine. There were many factors to their dissatisfaction, but the main takeaway is that hospital had to embrace telemedicine with very little prep time, and staff and faculty must deal with the extra load of working, including stress from COVID-19, and also the relative low reimbursement as compared to their effort. Very similar situation, I think. Now, let's turn the point of view of telemedicine to industry. With long quarantine periods, we saw digital therapeutic companies and telemedicine companies and various digital healthcare startups pumping up. We all seeing studies predicting the rapid growth of telemedicine and the tremendous market potential. Countries that already had worked on digital transformation of their healthcare systems quickly pulled ahead and gaining dominance. Mr. Ban, as a telemedicine company owner, how do you forecast telemedicine market potential?
I still very positive on the market potential, even though, as you said, there are so many hurdles and the resistance from the legal system and the medical provider and insurance. And But I still positive because telemedicine is a service was first introduced to resolve the imbalance between the supply and demand in the United States, United medical system. While telemedicine services gradually expanded, and even before the COVID-19 pandemic, there were still a lot of the registers from the fully implementing the mainstream from the medical service. However, this all changed with the COVID-19 pandemic. As a society shifted toward being untaxed society, the conservative attitude of existing medical service and regulator and the government and toward the new technology were forced change. This change created a forced learning of the telemedicine service in both of medical service provider and consumers and regulator and insurance. With such a learning effect, the telemedicine service began to become a common service provided, but not only the progressive, the medical service provider, but by many the medical service providers. According to the McKinsey research paper, the usage rate of telemedicine had been 11% in 2019 before the pandemic. But the usage rate of the telemedicine has been 46% during the pandemic. I think is a dramatic change. That's why I'm still positive on the telemedicine market potential.
Okay,
You
so
can see the PPT, the usage rate in the 2019 is 11%, and it become the 2020 it's 46%. It's huge change.
okay, so do you think the current will maintain after the COVID pandemic?
Yeah, there are many analysts. There. I think that there's still debate about after the pandemic. Uh, would their usage rate probably decrease from the current level, but uh, this learning effect, the learning effect can have some impacting can have a huge impact on our life. And uh, before the pandemic, I have never used a Zoom, and but after the pandemic, we're still gonna use the Zoom. I think it's the same situation. Many, many some people go back to the past experience, but some people will still remain in the current situation because of they already experienced in the the convenient situation, convenient experience with the telemedicine.
Okay, so you're always aware of the market situation. So when we talk about the telemedicine company, we usually commend the Teladoc and Ping An Good Doctors, Ping An Healthcare. And Mr. Ban, you're running a tele rehab service in the United States. Do you have any news on Teladoc recently? And how about the perspectives from the insurance company?
Teladoc is the biggest telemedicine company in US and the world. They began the business in 2002 with the telemedicine for primary care. The revenue in 2019 was about $600 million and about now $1.2 billion in 2020 and will be expected to be in $2 billion in 2020. They are growing fast, and their average growth rate is about 100%. Many analysts said that they will benefit from the pandemic, but they are saying that they're still forecasting Telecom fast growth even after the pandemic. Last year, the Teletech announced a cooperation with one of the biggest insurance company in the US. The name is Aetna. They will start nationwide primary care services with Aetna in 2020. I think it is a big event in telemedicine industry. This event tells us that the big insurance company already accept the potential of the telemedicine in their interest, in their perspective. Another big event was the merger with Livongo. It was a $18.5 billion deal. It's a huge deal. I think that is the biggest deal in the digital healthcare industry. Teladoc started with a primary care service, and their main business still primary care. Still primary care, but they are expanding the other areas such as the mental health care and the chronic care service. Livongo was a market leader in the chronic care for diabetic patients. We can interpret this event as the signal that in the post-COVID-19 area, telemedicine service expected to be in use in various fields, such as managing patients with chronic disease and psychiatric counseling and remote rehabilitation, not just medium of the providing the medical service to respond to the COVID-19 pandemic. I think Teladoc is changing the trend.
Okay, thank you for the news. Let's talk about the terminal device. What do you think about the current status of terminal device, Dr. Lee? What's your opinion?
While operating our home treatment center, another idea came to me about telemedicine. The idea was about terminal device. It's necessary to develop various terminal devices that can be used by patients. There are already many terminal devices on the market that can measure various vitals such as body temperature, oxygen saturation, heart rate, and even glucose level. However, improving the accuracy of such devices is urgent priority. In addition, the data must be transmitted automatically in conjunction with the hospital system, and more than anything, it should be comfortable for patients to use. In the case of ENT hospital, equipment such as nasal or ear endoscopy are released for home uses, but have not reached a stage where they can perfectly show the inside of the patient's nose to a doctor. Not only in endoscopy, but it's necessary to develop the terminal device for remote treatment in many other medical fields. Also, it's necessary to develop a platform where the data collected from such device can easily be sent and utilized effectively. Thank you.
Okay, thank you. And what's your opinion on terminal device, Professor Masaomi?
Thank you for your question, Professor Paik. We need to develop better terminal device. The current terminal device limited. We can get information, only sound and graphical information, pictures or faces of the patients and voices. We cannot draw blood as we do at our hospitals and analyze liver function or kidney function. We need to develop better devices. When we had the big surge of COVID-19 last summer after the stupid Olympic Games in Japan, many people unfortunately died at home. Our hospitals were overwhelmed and they had to stay at home and just died. In contrast, Israel, they provided terminal devices, as Professor Lee pointed out, the good instruments to the patients who stay at home, and no COVID-19 patient died at home in Israel. So it is very important to improve the better device for provide a better telemedicine. And as the vice president of the Biomedical Science and Engineering Institution of the University of Tokyo, we are collaborating with the Department of Engineering to develop better devices, but it's the future plan. Thank you.
Okay. So do you think if the terminal devices are more advanced, do you think the telemedicine will be more popular than this time? So if the terminal device is more accurate or more fine, so we can advance telemedicine, do you think? Or is other factors are more important than the terminal device? What's your opinion, Professor Masaomi?
Yes, I think so. And I agree with Mr. Ban's view.
Mhm. Okay. And what would be the barrier to deploy telemedicine service from the industrial point of view, Mr. Ban?
As you know, the medical industry is very complex, and we have various
Mm.
stakeholders,
That is
insurance
a
company.
very interesting question. I think improvement of terminal device will change the way we do medicine completely.
Okay, thank you. So let's turn to the Mr. Ban again.
Yeah. As you know, is the medical industry is a very complex is a very complex system, has a complex system, and the various stakeholder, insurance company, government regulator, and the patient and the medical provider and NGO, and we are seeing uh, we are seeing the kind of resistance from the all the stakeholder, the insurance company and the patient and the NGOs and the medical provider, and they're in generally and the new technology always getting when we adopting the adapt when we adopt the new technology we always I'm sorry, we always getting resistance from the old area, and I think the in same situation, but in medical industry more conservative, and especially in this point of view is a biggest issue is insurance. Without the without the solving the payment and insurance and reimbursement issue, I think is a very it is very difficult to adapting. It's very difficult to adapt the new medical technology, and medical service provider uh, uh, will not use the new technology or a patient without the insurance. Korean situation is a very different from the other country in the US, especially from the US. US has a very deep, very various many insurance company in the government insurance and the private insurance. Uh, it means that there are many choice. In some insurance company already accept the telemedicine and some area and special area. But in Korea, we have just only one insurance company, government insurance. They're very connected with the government policy. I think is a that's the biggest issue in Korea. We are very dependent on government the policy, because insurance regulation side and the insurance side, and That's the biggest hurdle in this point of view.
Okay, so to be included in the insurance systems, companies must go through the Korean FDA approval first, then a technology assessment by NECA, and lastly approved by HERA. So lots of hoops to jump through. We'll have to see how the government will cooperate with the industry to expedite these processes. So let me turn to the considerations for implementing telemedicine to make the transition into the hybrid medical systems and medical services. There are many issues to be solved in telemedicine, which were already raised. From doctor's point of view, for reimbursement, despite more time-consuming practice than usual care, and previous mentioned legal issues are matters, and all interest groups have their own take in telemedicine, and the Korean Medical Association is a stanch critic of telemedicine. And from the government point of view, telemedicine is inevitable. Korea is one of the fastest aging countries in the world. It's already an aged society, many who have chronic diseases. This will be a heavy societal burden. More care needs to be handled at the community level. In this situation, telemedicine will be the key. And the future medicine consists of 4 Ps: preventive, predictive, precise, and participatory. The best way to tackle all these 4 Ps is through digital healthcare, and telemedicine holds the key to delivering these services. To sum up, telemedicine should be considered as a crucial building block for future medicine, a way to help patients. My suggestion to start telemedicine from achievable, less controversial, and risky areas. For example, we could expand by starting from quarantining, assisting disasters, or medically vulnerable classes, then on to the monitoring chronic diseases such as diabetes, simple re-prescription, very sensitive endology areas, and slowly widen it to public health in general. Secondly, telemedicine should not come at the expense of further destabilizing the medical delivery system, especially in Korea. Patients and medical professionals alike have doubts about the quality of telemedicine. We should work to build trust gradually, and we welcome companies with innovative technologies and tools to help with this process. Medical data is highly sensitive data, so security should always be valued. Lastly, regarding medical fees and reimbursement, I think the best way we can do at this point without demanding a dramatic increase to fees is to give incentives, keeping people out of hospitals and clinics. The US and many other countries are going in that direction with value-based reimbursement or accountable care organization. So after all this, what we have learned, what are things we must consider as we take our next step? What would be the future of telemedicine, Professor Masaomi? I think there is a little lag between Korean and Japan. Professor Masaomi, can you hear me? Okay, so let's wait for a while. And in my point of view, as a tertiary hospital, I would like to commend the Mercy Health, the world's first virtual care center. They are one of the first to pioneer telemedicine into more acute areas with ICUs, sepsis, and stroke care. This virtual center delivers virtual care services to 600,000 patients across 7 states in the United States and truly demonstrate how telemedicine increases accessibility to medicine while reducing the total cost of care. I think many tertiary hospitals will provide this kind of services in the near future, and our hospital is also pursuing this. Uh, Professor Masaomi, are you still with us? Okay, then I would like to hear final comment from each of you. Dr. Sang-Dok Lee, you may go first.
Yeah, we, Hana ENT Hospital, are pleased that we can see a promising future of telemedicine through an effective home treatment of COVID-19 patients, both from patient and medical staff's perspective. Telemedicine is a global trend that can no longer be ignored. The development of IT technology, aging population, and the spread of infectious disease are some of the key driving forces of telemedicine. Therefore, it's time for the medical profession, academia, and the government to start discussing about telemedicine more seriously. Telemedicine is not only for the efficient medical service of now, but for the future of human well-being. A firm faith in the future is the solution of all troubles. Thank you for your attention.
Okay, Mr. Ban.
Yeah, telemedicine is still very early stage. We need to innovate the technology for to advance to the system and service, and we need to solve the many issues to adopt this technology and for those human being. But I think it's a big trend. I think we still we still have a room to improve our service and technology. But it is a big trend. We cannot ignore this trend. And I think that we need a time to we need to wait to for the system change, such as insurance and service and technology and patient and medical provider and medical provider education system. But I definitely believe that we can solve this issue, and in the future, and patient and medical provider and or insurance benefit from this advance of the technology. I believe.
Okay. Professor Masaomi, are you back?
Yes, I'm
Oh,
sorry
okay.
for the connection trouble.
Okay. So please give us brief comments on the what do you think the future of the telemedicine will be, and give us the final comments.
Thank you. I'm sure we will do more and more telemedicine in the future. We must. That's the way of medicine in the future. And if we can get parameters continuously at home, it will change the way of medicine completely. As you pointed out, Ping Group has a huge telemedicine in China, and the number of Ping Group users increased after COVID-19 pandemic. So I believe the number of telemedicine users will increase even after COVID-19, and we will continue our improvement. Thank you.
Okay. COVID-19 has unleashed consumer demand to provide everything and anything online, and medicine is no exception. I hope Korea and Japan's road to implementing telemedicine can be truly open and collaborative so that it can truly help patients lessen the societal burden of the government, and allow innovation and growth in the industry, whilst medical professionals provide high quality care. By now, I would like to close this fruitful and valuable webinar. Thank you, Chosun Ilbo, and all speakers who shared their valuable experiences and participants who joined this webinar. Thank you and goodbye.
Thank you very much.
Thank you.
Thank you very much.
Thank
Bye.
you.